Hi there, my name is Lauren Barker. I'm a specialist nurse practitioner and international board certified lactation consultant at the Vale Medical Practice. Today we're going to go through some frequently asked questions in regards to breastfeeding, and I hope you find this helpful. So the first question, which is a very, very good question, is what are the most common breastfeeding difficulties that you see in the first 6 weeks after birth? So the first 6 weeks are a huge period of adjustment for both mum and baby, and it's really important to remember that needing support during this time is completely normal. The most common challenge I see is difficulties with positioning and attachment, and if a baby isn't able to latch deeply onto the breast, milk transfer can be less effective, feeds can become lengthy, and mums experience nipple pain or damage, and often small adjustments can make a significant difference. I also commonly support families with concerns about milk supply, and many women feel and worry they're not producing enough milk, particularly during periods when babies want to feed very frequently, and in reality, frequent feeding is often normal newborn behaviour, but it's understandable why it can feel worrying. Other common issues include engorgement, when the milk first comes in, painful nipples, babies who are sleepy and reluctant to feed, tongue-tie concerns, and babies who seem unsettled or difficult to soothe. Around the 3 to 6 week mark, many parents are really surprised at how often their baby wants to feed, and they may feel that they had established a routine only for their baby to suddenly want to breastfeed every hour. And often this is a completely normal developmental stage, but it can leave parents questioning whether feeding is going well. And what I always tell families is that breastfeeding is a learned skill for both mum and baby, and it isn't something that necessarily happens perfectly from day one, and seeking support early can prevent those small challenges from becoming those bigger challenges. Another frequently asked question is, how can a mum tell whether her baby is getting enough milk? And that's really a difficult one. So it's most probably one of the most common questions I hear. So many parents look at their breasts and wonder whether they feel full enough, or they worry because they can't see how much milk their baby has taken. And the good news is that our babies give us lots of clues. One of the most important indicators is whether our baby is weeing and pooing. So by around day 5, most babies should be producing at least 6 heavy wet nappies every 24 hours. And regular bowel motions are really an encouraging sign. Weight gain is another key indicator, and it's normal for babies to lose some weight in the first few days after birth. But after that, we would expect to see a pattern of steady weight gain. And I also encourage parents to watch their baby rather than the clock. A baby who is feeding effectively often has deep rhythmic sucks and swallows and appear relaxed during feeds, and usually comes off the breast looking content and satiated. Other reassuring signs include the baby being alert and awake, meeting developmental expectations, having good skin tone, and appearing generally settled between those feeds. And it is worth remembering that breast softness, the absence of leaking, or not being able to pump large volumes are not reliable measures of milk supply. Many mums have excellent milk production, cannot express milk with a pump. And if there are concerns about weight gain, nappies, feeding behaviour, that's when professional assessment can be really valuable. Another really, really good question is about breastfeeding shouldn't hurt. So what are the common causes of pain, and when should women seek help? You're absolutely right, breastfeeding should not be painful. Some women experience a brief period of tenderness in the first few days after birth as they adjust to feeding, but ongoing pain is not something that should be accepted as normal. The most common cause of pain, and the one that I see most frequently, is a shallow latch. And if the baby is attached only to the nipple, rather than taking a large mouthful of the breast tissue, then this can cause some soreness, pinching, cracking, and sometimes bleeding. So I've got a very, very good crochet breast here that my colleague Josie very kindly crocheted for me. So this is your breast, this is the areola, and this is the nipple. And what we want to be making sure is that baby is not just attached to the nipple, because this is going to really hurt those nipples. It's going to shear off that top layer. You want the baby to be taking in some of the areola as well. Now, they're not going to be taking in all of the areola because it's quite a large amount there, but you do want them to take some of that areola in there at all. Sometimes pain is linked to things like tongue ties or other oral restrictions, such as a high palate, and that can prevent a baby from feeding effectively. And other possible causes can include engorgement, nipple trauma, vasospasm, very, very common, dermatitis, skin issues, bacterial infections, fungal infections, or even breast inflammation. What concerns me most is when mums are told simply, keep going, despite that significant pain. And pain is the body's way of telling us something isn't right. So I generally advise seeking help if pain persists beyond those first few days, if nipples are cracked or damaged, and if feeding makes you dread the next feed, or if pain is causing you to consider stopping breastfeeding altogether. The earlier that support is accessed, the easier it is usually to resolve the underlying cause. If you are physically lifting those shoulders up, you're clenching your toes, your hands, you're really struggling with that pain and you're not looking forward to that next feed, please reach out to a professional. Many mums worry about low milk supply, so what are the signs of genuine low milk supply and what are some of the common myths? And this is a really important topic because perceived low milk supply, or PIMS, is far more common than genuine low milk supply. So true low milk supply may be associated with poor weight gain, fewer wet or dirty nappies than expected, persistent signs of inadequate milk intake, or a baby who remains unsatisfied despite effective and frequent feeding. However, many things that parents interpret as low milk supply are actually very normal. So, for example, babies often cluster feed, particularly in the evenings. They may want to feed repeatedly over a few hours, and this doesn't mean that mum has run out of milk. Another common myth is that soft breasts mean there's no milk. In reality, once breastfeeding is established, breasts often feel softer while continuing to produce plenty of milk. And many parents also worry about they can only express small amounts with a pump. And pump output actually doesn't accurately measure milk supply and is influenced by lots of factors, including pump fit, timing, and individual response. Your baby will always be more effective than a pump. A baby waking during the night is also normal and not by itself evidence of that low milk supply. When there is concern, I do encourage families to focus on objective measures such as feeding assessment, weight gain, and wet and dirty nappies, rather than breast sensation or pumping volumes. So another really good question that I get asked quite a lot is, what advice would you give to mums whose babies are feeding constantly and seem unsettled after feed? So first of all, you're not on your own. Really common. One of the biggest surprises for new parents is just how much newborn babies feed. Nobody tells you these things. Many babies don't feed every 3 hours like the textbooks suggest. Instead, they often feed in clusters, especially during those growth spurts. And the first thing I'd want to assess is whether feeding is actually effective. Is the baby transferring milk well? Are they gaining weight appropriately? Are nappies reassuring? If those factors are all positive, then it's probably simple and normal newborn behaviour. Babies breastfeed for many different reasons. Yes, they are feeding, but they're also seeking comfort, snuggles, regulating their temperature, helping themselves fall asleep and soothing, and staying close to mum or caregiver. That said, a baby who seems persistently unsettled and is not gaining weight appropriately, has very long feeds with little swallowing, or is showing signs of discomfort may benefit from further assessment. I also remind mums that feeding constantly doesn't necessarily mean they're doing anything wrong. In fact, frequent feedings is one of the ways we can help babies establish and protect that milk supply in those early weeks. So remove milk to make more milk. Another really excellent question is, what can women do if they develop problems such as cracked nipples, blocked ducts, or mastitis? So the first thing to do is don't ignore these symptoms and hope they'll disappear. So for cracked nipples, identifying underlying causes is pretty important. So simply applying creams without addressing positioning and attachment often won't resolve the issue. Optimising that latch and feeding effectiveness is usually the priority. So doing upright positioning such as laid back biological holds, especially just checking that latch attachment, and koala holds, so upright positioning. Sometimes something called the flipple. So quite often the nipple actually points slightly downwards. So what we do is something called the flipple, which is where we actually position that nipple upwards, because you want that baby to be getting that nipple to the soft palate, and we're not shearing that end of that nipple. So really, really important there. So for blocked ducts or localized breast inflammation, continuing to feed normally is really important. So carry on feeding as you would usually do. Current guidance focuses on reducing inflammation and ensuring effective milk removal rather than trying to force milk through aggressive massage. So no deep massaging, cold compresses, pain relief if you need it. With mastitis, which is very common unfortunately, mothers often notice a painful area of the breast alongside flu-like symptoms such as feeling achy, feverish or feeling unwell. Now if you're having those symptoms, I certainly would be speaking to a health professional. Cold compresses, pain relief will certainly help with that. It may be at some point you may need some antibiotics, so certainly speak to a health professional about this. Breast hydration, normal breastfeeding and prompt support can often help, but really if those symptoms worsening or not improving within those 12 to 24 hours, definitely seek that medical assessment. Okay. One reassuring message I always share in that in most situations breastfeeding can and should continue during mastitis, as suddenly stopping can actually make that worse. Another really good question is, when and how should a mum introduce expressing on bottles if she wishes to do so? So really, this is about what matters to you and your family. So the answer depends on that individual circumstances and goals. So for a healthy baby who is breastfeeding well, many families choose to wait until breastfeeding feels established before introducing bottles, and this allows time for feeding to become comfortable and effective. However, there isn't one perfect age that applies to everyone. Actually, mums want to just solely breastfeed can still breastfeed. They don't have to introduce a bottle at all. They don't have to pump. So again, it's about what matters to you and your family. If a mum does need to return to work, caregiver needs to return to work and wants her partner to occasionally offer feeds or simply wishes to have some flexibility, expressing can absolutely be part of that feeding journey. I generally encourage introducing one bottle occasionally rather than replacing multiple breastfeeds unnecessarily. Consistent but gentle exposure is often more helpful than waiting several months and then trying to introduce a bottle suddenly. So when expressing, I encourage mums, caregivers to start with realistic expectations. Many are surprised that they don't collect large volumes initially, and that's perfectly normal. And there are lots of reasons for this. This could be because baby is much more effective at removing that milk. You don't have that lovely oxytocin going with baby. You're waiting for that milk ejection reflex. Flange fitting sizes may not be the right size for you. Lots and lots of different reasons. So importantly, expressing should support the mother's goals and well-being rather than becoming another source of pressure. Another great question is, what are the key signs that a mum or baby should seek medical advice rather than trying to manage a breastfeeding issue alone? And there are lots of situations where professional medical input is important and may be needed. For babies, I would advise urgent assessment if there are concerns about dehydration, very few wet nappies, excessive sleepiness, difficulty waking for feeds, ongoing weight concerns, jaundice that actually looks like it's getting worse, or any signs that the baby looks unwell. For mums, caregivers, I'd recommend seeking medical advice if they develop fever, flu-type symptoms, worsening breast pain, spreading redness, nipple trauma, or symptoms that aren't improving with support measures. Persistent pain during feeding should also be investigated rather than simply endured. I think one of the most valuable messages is that parents don't need to wait until things feel desperate. Early support usually leads to simpler solutions and a much better experience overall. So, closing question. If you could give every new mum in Bedfordshire one piece of breastfeeding advice before she leaves hospital, what would it be? That's a really, really good question. I would say, watch your baby, not the clock. So newborn babies haven't read the textbooks. You may be doing this for the first time. You may be doing for the 4th, 5th, 6th time. Some will feed 8 times a day. some 12, and some even more. And frequent feeding is usually not a sign that you're failing. It's often a sign that your baby is doing exactly what nature designed them to do. Trust that breastfeeding is a relationship that develops over time. It doesn't need to be perfect on day one. Be kind to yourself. Keep your baby close, lots of skin to skin, and reach out for support at the first sign of concern rather than struggling alone. And most importantly, remember that needing help is not a sign of failure. Every breastfeeding journey is unique, and getting support is simply part of learning a new skill that you are learning and baby is learning. And by the time your baby is a few months old, the challenges that feel enormous in those first few days are often just a distant memory, and you and your baby are learning together, one feed at a time. But please, if you have any problems, any worries, any concerns, please reach out.